Hi, Regan Gibson here. Today we're going to be performing the Indwelling catheterization checkoff. So I'm going to start with my safety practices. I'm going to check the order and check the patient's allergies. I'm going to assemble the necessary supplies and assess the patient. I'm going to wash my hands and don gloves. I'm going to identify the patient with 2 identifiers and identify myself. I'm going to provide for privacy, and then I'm going to educate, explain, and evaluate. So first, if the patient needed pericare, I would get those supplies and go ahead and perform the care for them. And then I'm going to position the patient. If it was a female, she would need to be in dorsal recumbent with her feet flat and her legs separated. And if it was a male, he would need to be in supine with his legs flat, slightly separated. So I'm going to go ahead and get my sterile field ready. I've got an extra pair of sterile gloving in case I need it. I'm going to keep my hands between my shoulders and my hips and maintain my 1-inch border. So I'm going to go away first. So I'm going to go ahead and get my sterile gloving. I'm going to maintain my 1-inch border here as well. I'm going to start with my dominant hand, so my right hand. I'm going to pinch the inside of this cuff and slide my hand up. Then I'm going to slide my fingers inside of this folded cuff and slide my hand inside. So now I'm going to go ahead and drape the patient. I would ask them if they could to lift themselves kind of up off the bed, and I'm going to slide this up underneath them shiny side down. And then I also have this drape here that just provides for a little bit more privacy if the patient would like. So we just open it up, and then it goes over the patient like this. So then I'm just going to go ahead and get my equipment ready. I have my alcohol swabs to clean the patient. I'm going to keep all of my supplies within that 1-inch border to avoid contamination. I've got my lubricating jelly that I'm going to go ahead and open up and just squeeze on the inside of the tray here so we can put our catheter in there. I've got my saline, and I'm going to make sure that I push out any air that's in there before instilling it into the balloon. So I'm going to go ahead and connect my saline, and I'm going to check the patency of the balloon. So I'm just going to instill a little bit to make sure that the balloon is inflating. All right. So then we're just going to go ahead and set the catheter in the lubricating jelly. We're just going to lay it right there. So now we're going to go ahead and clean our patient. We're going to use a new swab each time. And if it was a female patient, we're going to go outer, inner, and middle. And if it was a male patient, then we're going to start at the meatus, and with a circular motion, we're going to move ourselves down. So once this hand touches the patient, it's considered contaminated, so we're going to keep our hand up there to avoid contaminating my sterile field over here. So if it was a female, I'm going to take my fingers with a V and separate the labia. We're going to use a new swab each time. So we're going to go outer, reach around my sterile field to discard. Inner. And down the middle. Discard. So now we're going to insert the catheter. If it's a female, we're going to insert 2 to 3 inches. If it's a male, we're going to insert 7 to 9. And then once we get urine return, we're going to advance it another 1 to 2. So we're going to ask the patient to bear down as if they're needing to urinate. And then we're just going to insert. So then we're going to instill our saline. we're going to disconnect this card. So then we're just going to pull on the catheter just a little bit to make sure that the balloon is in place, and then we're going to slightly advance it. And then after we have done that, we are going to make sure that we tape the catheter tubing on the inside of the patient's thigh, and then with our collection bag, typically the hospital beds have clips on the bottom that you can hang this on, but you want to make sure that it is below the patient to avoid any backflow of the urine into the catheter. So after I'm done, I will just clean up my supplies and document.